is a 14-year-old boy who is brought to office by his parents because he states that for past 2 months he has been feeling constantly tired. He also reports dull pain in the pit of his stomach. The patient has no relevant family history. Vital signs are kind of normal. Abdomen is distended and there is hepatomegaly, 5 centimeter. CBC shows that hemoglobin is high, hematocrit is high, RBC count is high, leukocyte is as well high, neutrophil high, lymphocyte high, platelet count is kind of normal but still on higher side. Coagulation test is normal. Doppler ultrasound image is shown below. Which of the following is most likely etiology of the patient's diagnosis? Options are Behcet syndrome, antiphospholipid syndrome, protein C deficiency, factor V Leiden mutation, polycythemia vera. So the question here is, what is the etiology of patient's diagnosis? This patient is having portal vein thrombosis. Now what the question is asking is, what is leading to, due to what condition is this patient having portal vein thrombosis? So you have to understand that this is a Doppler ultrasound. I do not understand this Doppler ultrasound as very much, but I think it is not necessary to understand Doppler at level of USMLE step 1. But there are certain things which are pointing to portal vein thrombosis in this question. First of all, there's pain in his stomach, there is hepatomegaly, there is distension of abdomen. So we have our portal vein going to the liver, and there is a thrombosis in that vein, and the thrombosis is leading to the back pressure, which is causing hepatomegaly. So what is happening here is that this patient has developed thrombus in a portal vein, which has led to hepatomegaly, which has led to abdominal pain, distension of abdomen. Now what they are asking is, what developed this portal vein thrombosis? So there are multiple etiologies of portal vein thrombosis. It can be due to, let's say, things like polycythemia vera, or essential thrombocytosis, essential thrombocytosis, yeah, ET. Can be due to antiphospholipid antibody syndrome. It can be due to multiple causes. Portal vein thrombosis can happen due to multiple causes. So first of all, we identified that our patient is having portal vein thrombosis. Now we have to identify, out of the multiple reasons that can cause portal vein thrombosis, what is the reason in our patient. So in our patient, they have clearly mentioned that he has a very high hemoglobin hematocrit count, and his erythropoietin is low. Coagulation is completely normal. So all the conditions which cause thrombosis due to coagulation are ruled out. APLA is ruled out. Protein C deficiency, and then that factor V Leiden, all of them are ruled out. Any kind of condition that can lead a clot due to clotting factor issues are completely ruled out, because the clotting counts are normal. The clotting test is completely normal. So in our case, there's a clear-cut picture of increased red blood cells count, increased RBC, increased hematocrit and everything. So we can put that the etiology in our patient can be polycythemia vera. So is this question clear? So there are two things going on in this question. There are two things going on in this question. The first thing is, you have to first of all identify what is the diagnosis. Many times we just stop looking at diagnosis, and somehow we develop an association in our brain that polycythemia vera is the only thing that can lead to portal vein thrombosis. But that is not true. You have to first of all identify that this patient is suffering from portal vein thrombosis, which is leading to hepatomegaly and distension of abdomen. And in our patient, this portal vein thrombosis is due to polycythemia vera. However, there are multiple causes of portal vein thrombosis as discussed, like APLA and other clotting factor issues.
Thanks for watching. Please give a thumbs up and subscribe for more.